So the question is do you think that targeted focal therapy has a role in prostate cancer, and do you think that it will actually exist and take off here in the United States?
So the answer to the first question, do I believe that it will take off and that it has a role, is yes, I do. The difficult part of the next part of the question is, how do we know which patient and which clinical scenario is best served by doing focal therapy? We do know, based on our pathology reports, after we remove a patient's entire prostate, that the cancer oftentimes is multifocal, meaning that it's in several different locations and in both sides of the gland. Part of the evolution of these treatment modalities is going to rely on better and more accurate diagnosis. And right now, what is promising and seeming to be very helpful are multifocal biopsies under an anesthetic where the prostate is better sampled. So those of you who have had prostate biopsies know that typically we do 12 biopsy cores. If you were to extend that and do 40 or 60, you can imagine that in some cases you'd actually remove the entire prostate by way of biopsying it out. But you'd also get a very, very accurate sampling of the entire gland and where potential areas of cancer are. So that's one option for better identifying the gland and where cancer is. And the other is with specific imaging, and in this case MRI seems to be a very promising modality for looking at the prostate in great anatomic detail. If we can somehow marry these imaging and hopefully minimally invasive biopsy definitions of the gland and where the cancer is, we can then focally target our treatment. And there are promising, although not yet definitive ways of doing that, but cryotherapy or freezing of the gland, thermal ablation, potentially other treatment modalities such as ultrasound and heat treatment to the gland are all showing signs of being promising, being able to be highly focally targeted. And if we combine that with proper diagnostics, we may be on the path towards the male prostate lumpectomy.